Hi everyone, good evening. Bonsoir tout le monde. Bienvenue à une autre session questions et réponses avec moi. Je suis Susan Holt, la première ministre du Nouveau-Brunswick. Hi, I'm Susan Holt, the Premier of New Brunswick, and we're going to do another live Q&A session tonight. But first off, I wanted to start with just a quick thank you to Crystal and Stalin Venator, who sent me this amazing Jokes Are For Everyone book. And I really appreciated it. There's some good chuckles in here. I thought I'd share one joke with all of you. I picked a Halloween one. So Stalin, if you're watching, thank you very much for this. Sometimes when things get tough in the Premier's office, this brightens my day. So this joke says, who won the skeleton beauty contest? Nobody. It's a good one. Anyway, merci beaucoup, Crystal and Stalin. Really appreciate that. It's great to have such creative people in our province. OK, je vais vous expliquer comment on a géré cette session questions-réponses maintenant parce que c'était un petit peu différent que la dernière fois. Nous testons des différentes approches pour ce qui fonctionne mieux et nous aimerions avoir vos retours. Je pense, I think I'm also supposed to share, if you're looking for simultaneous translation, the links are available on my social media. So there's an English feed, a French feed. There might be an original feed on YouTube at least. Okay, yes, I'm getting nods. Alors, moi, je vais switcher. I'll switch between English and French a little bit, and then I'll answer the questions in the language that they were received. In some cases, we get the same questions in both languages. Alors, moi, je vais être en français, en anglais, des points différents. On a l'équipe de traduction qui sont ici pour que vous pouvez comprendre. So, this is what we did this time. We opened up the online site to receive your questions between October 9th and October 22nd. So we left it open for 2 weeks. And in that time, we received 273 questions in English and 18 questions in French. Alors, après ça, on a fermé l'opportunité de mettre des questions et on vous a laissé voter sur la question qui a été posée. Chaque personne a reçu 4 votes qu'il pouvait mettre sur n'importe quelle question il voulait. Sur les 300 questions qui nous étaient données. So we left the voting open from October 23rd right through till October 30th for 1 week. So we received 147 votes on the French questions and 1,943 votes on the English questions. And so I'm going to go through and answer the top voted questions. I think the most votes that any one question got was a little over 200. So really popular question, then I'll work my way down as the time rolls on and get through as many questions as I can for you. Nous avons diffusé cette session directement sur mes réseaux sociaux. Alors, c'est sur Facebook, Instagram, YouTube, LinkedIn. Vous pouvez trouver le lien là pour le canal de traduction. Et vous pouvez mettre des commentaires là aussi si vous avez du feedback sur ce système en comparaison au système qu'on a utilisé les premiers quelques fois qu'on a fait une session en ligne comme celui-ci. I think that's all I need to provide in terms of the off-the-top feedback. So let's jump right into the most popular question that was asked this time. This one was asked both in English and in French. So the French question was, Bonjour madame, concernant la qualité de l'air, quelles sont les actions menées par la province pour limiter ou réduire l'usage de glyphosate? And in English, the question was, why does New Brunswick still allow glyphosate spraying in forests despite proven harms to health and environment? And why are taxpayers footing the $26 million a year to subsidize J.D. Irving's use? It's time for something safer. And a similar question, when will you put an end to glyphosate spraying? So we combined all those 3 questions up. That generated 193 plus 29 plus 25 votes. And so that's the one that we're going to start with today. So Minister Lepage, who is our Minister for the Department of Environment and Local Government, in his mandate letter, there is an item, I guess, that we're looking for him to complete that includes a review of pesticide use in this province. And so that's something that we are looking to get completed in our mandate. But that work is ongoing, and I think there's some studies that we have scheduled that are going to begin next year. So there's going to be opportunities for public engagement on those studies. The minister is working with the minister and are working with other departments on the work to achieve his mandate of reviewing pesticide use. And then the focus really has been on the recommendations that came from the steering committee for the standing committee, the standing committee of the legislature on climate change and the environment. They issued recommendations under the previous government that were unanimously supported by the members of that committee, but actions hadn't been taken on those recommendations yet. So our government is moving on the recommendations that they made to restrict and reduce glyphosate use around the province so that it is bigger buffers, more tightly monitored, that kind of thing. Je vais juste checker si j'ai laissé. OK. Je vais répéter en français pour ce que celui-ci était demandé dans les deux langues. Alors, il y a une lettre de mandat du ministre Lepage qui comprenne l'examen de l'utilisation des pesticides dans la province. Et ce travail est en cours. Le ministre collabore avec des autres ministères qui sont concernés et notre équipe concentre sur les recommandations présentées dans le rapport préparé par le comité permanent de changement climatique et de la gestion environnementale. Les travaux sur les autres éléments du mandat, y compris la réalisation des études, doivent débuter l'année prochaine et comprendront des occasions pour la participation publique. Alors, on vous demande de participer dans le travail pour les évaluations des pesticides et notre travail pour accomplir les recommandations de la comité. Next question. So this one, there was also a French and English question that were similar. So the English question was, what can be done about high electricity bills, property taxes, They are pushing seniors out of their homes. La question en français était, bonjour madame, quelles sont les actions de la province pour contenir l'énergie chez Énergie Nouveau-Brunswick? Alors, on a reçu 126 votes pour la question en anglais, 27 votes pour la question en français. C'était la deuxième question la plus populaire. So there's a number of things that we have done about electricity bills and property taxes. I'll try to combine the two a little bit. One of the first things we did when we formed government was take 10% off of NB Power bills. So you'll see starting January 1st of 2025, there's a 10% rebate line that took that 10% off of your power bill. That was the first step that we took. Then we realized that there's significant challenges that NB Power is facing, and so we ordered, well, first the audit and now a comprehensive review of NB Power. That work has been ongoing and is due to come back to us in the form of recommendations in March. The next thing we did, because we had seen numerous years of pretty high increases, 9% plus increases to power rates, we changed the date. We removed the debt ratio target that was in place to take some of the pressure off that was driving rates up. And then we saw instead of a 9% rate increase this year, a 4.75% rate increase request that NB Power has filed, in part because we removed that debt ratio target. And then we're waiting to see that that's going through the EUB hearing process, and we're looking forward to taking action on some of the recommendations that the comprehensive review panel will bring forward. In terms of property taxes, we froze your property tax assessments this year. So the bill that you'll get that comes through this winter will have a frozen assessment level, and then depending on what municipality you live in, whether they have chosen to freeze their rates or move their rates will impact whether your property taxes go up or not. And in the meantime, we're overhauling the property tax system because we think it does need to be more predictable, more competitive, less volatile, so that people aren't seeing dramatic changes year over year. And that work is ongoing right now. In fact, there was a public survey put out that received thousands and thousands of responses. So great to see the engagement of New Brunswickers with your ideas for how we can make our property tax system clearer, more simple, easier to understand, and more competitive for everyone. And within that, we're also receiving suggestions, just to bring it back to the question, about property taxes for seniors. There are other provinces in Canada that have different forms of discounts for people depending on their age, their retirement status. Sometimes it's a freeze to property taxes. Sometimes it's a discount of 5% or 10% on property taxes. So we're looking at ideas like that, suggestions like that are happening around the province, across the country. To see if any of those will fit into the kind of property tax system that we bring forward in 2026. Alors, il y a plusieurs choses qu'on fait pour essayer de réduire vos factures d'électricité. La première chose était le fait qu'on a supprimé 10% des factures d'électricité dès le 1er janvier, juste pas même 2 mois après notre assermentation. Et on a vu que Énergie Nouveau-Brunswick avait des enjeux. Alors, on a demandé pour un examen au complet de Énergie Nouveau-Brunswick. On attend des recommandations et nous sommes prêts à mettre en place des recommandations de ce comité-là. Mais en même temps, on a fait un ajustement à leur cible du ratio de l'endettement. Ça, c'était quelque chose que la pression d'atteindre un cible de leur ratio d'endettement, c'est quelque chose qui a contribué à la hausse de les frais d'électricité dans les 9%, 9 points quelques pourcentages. Alors, on a enlevé cette pression-là et cette fois-ci, on a vu une demande, pas pour 9%, mais 4,75% de la hausse. Alors, moins, je comprends que c'est encore un taux élevé pour plusieurs personnes. Alors, nous sommes hâte de mettre en place des changements pour le futur pour avoir des factures d'énergie Nouveau-Brunswick plus stables et abordables pour les Néo-Brunswickois et Néo-Brunswickoises. On fait aussi une réforme aux impôts fonciers. Alors, on a fait un gel de vos évaluations des impôts fonciers pour cette année. Alors, la prochaine facture que vous allez recevoir va avoir cette gel là-dessus. Et dépendant de quelle municipalité où vous vivez, on va voir peut-être qu'ils vont avoir aussi un gel de leur niveau de taxation ou peut-être ils vont avoir un ajustement. Mais nous autres, de notre part, on a fait ce gel à cause du fait qu'on fait une réforme des impôts fonciers, puis on demande pour vos suggestions, on cherche des façons à rendre les impôts fonciers plus prévisibles, plus stables, plus compétitifs, plus faciles à comprendre et savoir c'est quoi cette chiffre qui va être à chaque année. On reçoit des suggestions au sujet des aînés et des façons dont les autres provinces donnent peut-être des rabais ou des supports pour les aînés avec leur système d'impôt foncier. Alors, c'est quelque chose qu'on considère à ce moment à cause de notre travail du réforme. Puis ces changements, on va les mettre en place en 2026 pour que l'année prochaine, votre facture dans l'hiver, ça va être un gel. Puis l'année après ça, ça va avoir le changement de notre réforme. Okay, next question, number 3. This one is, so this one's the timing is a little funny. So the question is, when are you getting rid of the carbon adjuster that's adding 8 cents per liter to the price of gas? You keep promising it. Why are you not dropping gas tax like you said? It has doubled. Pourquoi devons-nous payer la taxe carbone pour les compagnies et les raffineries qui s'enrichissent? Les autres provinces ne font pas ça. Allez-vous tenir votre promesse électorale et nous protéger? So we had 89 plus 25 plus 14 people vote for these 3 questions, all in the same vein. And so we announced today actually, that we will proclaim Bill 4 and remove the cost of carbon from the price of gas, and that's going to be effective December 1st. And so the price of gas should drop by 8.24 cents on December 1st, delivering on that promise and giving you some relief at the pumps, because we have heard consistently from New Brunswickers going back to last summer before we made the commitment and all the way through the past year that the cost of living is high. The cost of groceries, the cost of rent and mortgages, the cost of gas, the cost of living is a real challenge in New Brunswick. And so we delivered on this promise. It's going to come into effect December 1st. And we're really doing everything we can to try to deliver relief to you. Il y a une question aussi, pourquoi c'était promis, pourquoi ça a pris 1 an pour le faire, parce que c'était le novembre dernier où on a mis le projet de loi à l'Assemblée législative pour la première fois. Il y avait des objections. Il y avait des objections de l'industrie, de l'opposition conservateur qui ne voulait pas qu'on fasse ça. Et nous autres, on leur a donné la chance de s'exprimer. On a écouté les intervenants. On leur a donné l'opportunité de présenter un comité de l'Assemblée législative. On a considéré leur point de vue. On a demandé à la commission de faire un revue de la marche. Ils l'ont fait ça. Alors, on a donné toutes les opportunités. On a écouté tous, mais on pense que c'est le temps. Les Néo-Brunswickois méritent avoir cette aide, cette promesse réalisée de réduire le coût de la carbone, enlever le coût de la carbone, l'ajustement de la carbone sur le prix de l'essence. Alors, on l'a enlevé. Le 1er décembre, 8,24 cents qui va être enlevé le prix de l'essence pour vous autres, pour vous aider à avoir une vie abordable ici à Nouveau-Brunswick. Alors, je suis heureux qu'on l'a fait finalement. Je sais qu'il y a des gens qui sont inquiets pour des petites stations de gaz dans leur communauté. Il y a un processus avec la commission pour démontrer les coûts réels, pour ce qu'on peut assurer que les Néo-Brunswickois ne payent pas trop pour l'essence ici dans notre province. I'll go on to the next question. I'm trying to think if I did that one balanced in English and French. It felt more French, but okay. Going on to the 4th question, I believe, now that I've lost track. 1, 2, 3, 4. Why won't you stop the NB Power rate hikes every year? So this question received 85 votes. It was only asked in English. And so I'll do my best to tackle this one now. In the past, there have been times when government has intervened in the process with the EUB, with the NB Power rates, and held rate increases to 0 or held them at 1% or 2%. That's happened on and off over the past many decades, with different governments of different stripes getting involved to hold or delay or to put off increases to power rates. That might be one of the reasons why power rates in New Brunswick are lower than our neighboring provinces, is because of continued years and years of holding increases pretty low. And with that, we've generated a significant amount of debt and have had challenges managing the finances of NB Power in terms of investment and maintenance. And so we have a real balance to strike here as New Brunswickers struggle with, as I said, the cost of living, with rate increases, with electricity bills that are getting bigger and bigger, with our energy consumption increasing. It's something that's really challenging for people at home. And the situation of the past has been really challenging for NB Power, who's burdened with a debt that doesn't allow them to do some of the things that they need to do. That's why we launched the comprehensive review. We think we need a different path with NB Power, because we can't continue this way. We can't continue generating the kind of debt that the utility has. We can't continue with double-digit rate increases. I don't think that the population can bear or can afford that. So we need to find a way to change the structure of the utility, its policies, its programs, something, anything, everything, that will allow for us to deliver affordable, reliable, sustainable power to New Brunswickers in a way that they can afford. So we're trying to find that path now, but we don't want to continue doing what past governments have done, artificially constrain rates down, watch the debt pile up for future generations, and not tackle the actual problem, get at the status quo, and get this utility and energy costs in New Brunswick on a new path. So that's what our government is prepared to do. Now, NB Power goes through their regular business, so they have a process of applying for for rates to the EUB, a little bit like we talked about on gas. They have to show the cost to deliver energy, how much it's costing them, and thus how much they need to charge in order to recover those costs. The EUB considers all that information, decides whether they think that's accurate, rules on the rate application, sometimes pushing it down, sometimes accepting it as is. And so that will continue to go through the regular process that it goes through until such a time as we either receive the recommendations from the comprehensive review, make some changes to the act, to the regulatory process, or otherwise, and set forward on a different path. Okay, next question. So this one was really close to the NB Power question that had 84 votes for this question. When will you support adult day centers with funding that is comparable to the needs of care, programming, and food? This is a great question. I actually met someone not too long ago from Meaningful Connections in Oromocto who raised this exact issue with me, particularly around the cost of food and how it had gotten more and more expensive, but the supports from government hadn't changed, and so their ability to serve their clients was diminishing. So social development, for folks that aren't familiar, provides a per diem for every client that participates at an adult day center. The per diem was increased last year from $40 a day to $45 a day. And there isn't a financial eligibility assessment that's done for participation in adult day centers. They just have to be eligible for a long-term care program. So that's a change that we've made to make it an easier program to access. Social development does receive requests from adult day centers for additional support to meet the needs of their clients and their communities. They'll look at additional staffing. Cost of snacks and meals are typically the responsibility of the clients. So that's a policy that, because it's been raised with us and because those costs are being covered by a number of the centers that do that on behalf of their clients, it's something that we're going to have to look at. The policy had been that was paid for by clients, but recognizing, as I said, not only those costs going up, but people are having a hard time making ends meet. And so looking at ways that we can maybe improve the supports beyond the increase to $45 a day and the change in the assessment process. Next question. Why is the province allowing NB Power to contract an American company to build a gas plant in Tantramar to the detriment of the land, the water, the air, and the residents? So this question received 67 votes. And this one I could probably talk about for a long time. I'm conscious that we're almost halfway in here. So this started off with NB Power. So NB Power was looking at their forecasts for energy demand, and when they did a re-examination of those forecasts, they saw that our ability to supply power against demand was going to be constrained as early as 2028. And they thought we have a need for more generation, and particularly generation to support the renewables project that NB Power had been working on. And this is something that government has supported and directed NB Power to do, was to go out and look for expressions of interest to develop more renewable energy in New Brunswick. They did that. They tendered 650 megawatts of renewable energy, received lots of wind projects, solar projects. I think 450 of those megawatts were contracted. They've put out a second call for another 400 megawatts of renewable energy to be added to the grid. And with that much renewable energy, we're now looking at our tools to balance those renewables. So as that wind power comes online and the solar power, we use our coal generating stations, so Coulson Cove and Beldoon. Those are our balancers right now, because you can fire them on and fire them off pretty easily. We use Mactaquac as well. Mactaquac is really great in a pinch. If LaPro goes down, Mactaquac can open up and make sure that there's a stable supply of power. But we needed something to add to the system that could generate power and balance renewables before our generation capacity was extended past what we could deliver in 2028. So the technologies out there that I'm told were available was this gas peaker plant that acts as that balancing piece that you can fire on at the drop of a hat, that uses natural gas as its energy source, and was something that could be actually built, installed, created, and then turned on within this sort of limited 2-year window that we have to get a project done. So NB Power put out a tender and asked companies to apply and provide solutions. A number of companies did. The least expensive bid, that was also the only one to meet the timeline of 2028, was a company in the US. I believe they're called ProEnergy. And so ProEnergy was awarded the contract, and then they began the process of identifying sites. I think they were looking at sites in Skuduk initially, in Tantramar. I think there were other sites evaluated. And now they've gotten into the process of what they believe to be the best site in Tantramar, and going through now an environmental impact assessment process to determine whether that can work there based on our standards and expectations from an environmental protection perspective. I very much appreciate the challenges that folks have had with information about this project, with engaging as a community, with questions that people have wanted to ask, with opportunities to get that information from the proponent, with the validity of that information. There has been lots of challenges through these early stages of the project, and so a lot of work that needs to be done to make sure that all of the questions are being asked, all of the information is coming forward, is getting vetted and validated to determine whether this can work. We're asking questions as well about alternatives to make sure that we can deliver the power New Brunswickers need as affordably as possible, as sustainably as possible, and in the most environmentally friendly way possible. We can't run out of power. We can't charge people through the roof for power. We do not want to harm the environment with our generation of power. And so this is a project that's looking at making sure we don't run out of power in the most cost-effective way, and looking at the environmental impact of it right now. The environmental assessment hasn't been completed or approved. So there's still more work, a lot more work to be done on this one before it is at any sort of final or go-ahead stage. That's that one. I'm going to pause. Thank you, Belleville Orchards, or thank you, Natasha, I should say, our MLA from Diet Memram Cook, who brought in some sparkling apple juice from Belleville for our team last week. OK, la prochaine question. Quand allons-nous avoir une hausse raisonnable pour nos pensions de vieillesse pour suivre le coût de la vie qui continue à monter avec la hausse de 0,07%? Ça ne sera pas assez. Alors, cette question était la prochaine question la plus populaire des questions en français. Mais la question de la pension de vieillesse, ça, c'est quelque chose qui est la responsabilité de la gouvernement fédéral. Alors, le gouvernement provincial ne détermine pas les taux des pensions, des RPC. Alors, on vous encourage de parler à votre député fédéral si vous pensez que les ajustements de coût de la vie devraient monter pour les pensions. Nous autres, on offre toutefois une prestation provinciale pour les aînés à faible revenu. Alors, vous pouvez présenter une demande jusqu'au 31 décembre à chaque année. Et si votre demande est approuvée, vous pouvez recevoir jusqu'à 616 $ pour vous aider face à la hausse de la coût de la vie. On cherche aussi de nouvelles façons de soutenir nos aînés, des supports. On parlait des impôts fonciers et la possibilité d'avoir un programme de support dans cette facture-là aussi. Mais pour cette question des pensions, c'est une question fédérale. The next question that we received, so this one had 46 votes for it, is why are seniors in New Brunswick having to pay for the shingles vaccine when the other Atlantic provinces are giving it for free? So this is a question that I've received quite a bit ever since our neighboring provinces. I think in Nova Scotia, I know Newfoundland had said they were going to do it. I think they're in the processes of working that out. I believe Nova Scotia just announced a number within this last year that they're going for it. and PEI as well. And so we are exploring it as well. We're looking at the options to publicly fund it, what it would cost. We're engaging with the folks nationally who maintain a national vaccine registry. It was the same process we actually just went through for the RSV vaccine, that our government decided to fund and make the RSV vaccine for seniors make the RSV vaccine free for seniors in this province. But we went through the process of making sure that it was approved and studied at the federal level, and it was, and that was the recommendation. So we want to look at that health evidence. We want to assess the programs, the different age cutoff levels that different provinces are using for this one, make sure that we know the costs and the delivery mechanisms. But I appreciate that this is something that people are paying hundreds of dollars for, that it is absolutely not pleasant to have shingles, and can, if you're vulnerable or older, find you in a hospital dealing with it. And so anytime we can prevent hospitalization with an upfront investment to make a vaccine more accessible, that's good policy. So this is one that we're looking at, and we'll do the proper due diligence, but understand that it's something that New Brunswickers are looking for, and we'll work to move on it as quickly as we can. Okay, la prochaine. This one's a big one. I'm just gonna check the time, 7:30, so good, because this one will probably take quite a bit of time, but we finally get to a health question with 43 votes in English and 11 votes in French. The way the question was worded: Cela fait plus de 5 ans que ma famille et moi, une famille de 5 peut-être, nous sommes sans médecin de famille. Nous sommes sur la supposée liste de liens santé, Régie 4, jamais référé malgré l'arrivée d'un médecin, avec une question. And then the English version was, what is your concrete plan to improve healthcare and reduce wait times? ER, tests, surgeries, referrals to specialists, and when can we expect to see improvements? So lots of pieces in there. I'm going to talk through a bit about the things that we've done in the last year to change the healthcare system, and how we believe that affects wait times and access to care, and the things that we're doing to help families who have been on the waiting list for a family doctor for 5 years in this case, or others, get that wait list eliminated and get people the primary care that they need. So right away, we started implementation of our vision of what a collaborative care model of healthcare should be, and what the family health teams could be in New Brunswick. That starts with the simple model of bringing together doctors and nurse practitioners, nurses, pharmacists, physiotherapists, all sorts of different health practitioners together to provide the right service to New Brunswickers right there in their community when they need it. And figuring out, how do we support that kind of model of care? What kind of administrative supports do we need to provide? What kind of technology supports do we need to provide? How does the compensation system need to change? What are the policies? What is the legislation that needs to change to allow for this to work? Because you can imagine there's lots of bureaucracy and rules that say you can't do this, you can't pay for that, that kind of thing. So we've been working with the regional health authorities, with Horizon and Vitalité, on what our vision for this collaborative care model is. We had committed to putting that in place in at least 10 clinics this year in 2025. As of now, we've got 7 open, but I am guaranteeing that we are going to have at least 3 more announced, confirmed before the end of this year, and that those teams of people where we have added doctors or nurse practitioners, social workers, respiratory therapists, you name it, provided them with administrative support, provided them with the technology, in some cases the space to provide care, have started taking people off the waiting list for care. So the 7 clinics that we've done so far, those clinics have committed to taking 10,600 more people off the waiting list. So far since April, Horizon, is it Horizon that tells me? Make sure I might get this data right. I think it tells me that we've gotten about 8,100 people have received care since April, although I think now I'm bouncing into a different box. And so there's more to be done there. Obviously, we've got 3 more clinics to open this year. And then next year, there's going to be at least 10 more family health teams started in the province. On va aussi avoir, on va voir les résultats de nos investissements dans la formation. So if I take a step back from primary care, we have to make sure that we have the pipeline of nurses and nurse practitioners and family doctors and others in the system. Alors, notre gouvernement a investi dans la place de formation pour le centre de formation médicale à l'Université de Moncton. C'était 32 places, mais avec nous autres, on a ajouté 8 places pour que c'est 40 places pour former des médecins ici à Nouveau-Brunswick. Avec notre partenariat avec Dalhousie Université à Saint-Jean, il y a une autre 40 places pour les médecins, pour le programme de médecins de famille anglophone à Saint-Jean. Alors, on peut former 80 médecins de famille ici au Nouveau-Brunswick et on a ajouté les résidences, le support pour les résidences qui vont avec ce programme-là. On a aussi vu le commencement de plusieurs infirmières dans nos programmes de formation des infirmières ici au Nouveau-Brunswick. On a fait des primes de rétention pour les infirmières ici au Nouveau-Brunswick parce qu'on a vu qu'il y avait un exode des infirmières du Nouveau-Brunswick, comme l'étude qui était publiée quelques semaines passées a démontré que jusqu'à 2023, il y avait tellement d'infirmières qui quittaient leur travail ici à Nouveau-Brunswick. Alors, nous autres, une des premières choses qu'on a fait était les primes de rétention pour les infirmières pour assurer qu'ils restent dans notre système, on peut les retenir et qu'on avance nos travaux de recrutement. On a juste terminé notre contrat collectif avec le syndicat des infirmières. Alors, ça, avec une rémunération compétitive avec la Nouvelle-Écosse et d'autres, ça va nous aider aussi à attirer et à retenir nos infirmières. So with the work on retaining nurses, getting that collective agreement done that is competitive with our neighboring provinces makes it attractive to be in nursing here, with the investments in family doctor positions at the University of Moncton and Dal Med in St. John, with the transformation of the primary care model and the rollout of those 7 family health teams. We've been making some pretty big strides, and at the same time, lots of work being done on technology. I want to give you some specific numbers, and this is hot off the presses, new data. I don't think that we've pushed out yet. Since taking office, November of last year, we have hired 157 doctors. Now, I'm going to couch that with the fact that, as we all know, there are numerous retirements happening. And so we hired 157, 73 exited the system or retired. But that means 84 net new doctors have been added here in New Brunswick over the last 12 months. And we're excited about that. And actually, if I talk about just the last 6 months, so if we go back to April, which is where our fiscal year starts, we have added 34 family doctors specifically. So 34 new family doctors hired, 18 practices that closed or family doctors who left. So that means 16 net new primary care doctors. And then in terms of specialists, we hired 59 new specialists here in New Brunswick. We unfortunately lost 19 who exited either for retirements or other reasons. And that means 40 net new specialists in New Brunswick. So last year, if we look at the fiscal year that ended in March of 2025, the total was 64 doctors in New Brunswick. This year, in the first 6 months of the 2025-26 fiscal year, we have 56 new doctors hired. So we are ahead of the curve with 6 months to go. I think we're going to blow last year's result out of the water because the team has been working really hard on that recruitment and to make sure that we have attractive places for family doctors and specialist physicians to practice. I think about here in Fredericton, the hybrid OR that we've invested in at the deck that's helping us to recruit and attract vascular surgeons is an example of that. And I also want to give you the nurses' numbers because these are important as well. The whole system works when we have all sorts of different health professionals, allied health professionals, nurses in the system, along with the doctors I've listed. So a whole bunch more numbers for you. On a embauché 385 infirmières l'année dernière. on a vu 153 qui ne sont plus dans le système. Alors, ça veut dire 232 nouveaux infirmières. Non, RN is infirmière matriculée. Matriculée, merci beaucoup. Ça, c'est beaucoup plus que l'année dernière. Alors, cette chiffre de 232 nouveaux dans les 385 qu'on a embauchés. Et pour les infirmières auxiliaires, on a eu 205 qui étaient embauchées, 69 ont pris leur départ du système. Et ça, ceci, c'est dans le système de Horizon et Vitalité seulement. Alors, ça ne compte pas les infirmières dans le système de soins à long terme. Mais 205 moins 69, c'est 136 nouveaux infirmières auxiliaires ici au Nouveau-Brunswick. Alors, ça, on développe, on agrandit nos main-d'œuvre dans les professionnels de soins. On change le système pour que c'est une meilleure place pour soigner de l'avenir brunswickois et brunswickoises. On investit dans la formation. On a un nouveau programme pour les paramèdes. Je m'excuse, I'm going to probably need a Kleenex here shortly. There is a cold going around. I hope everybody's getting their flu shot. So we put a paramedic bursary program in place to also help make sure that we had the health professionals that we need. And this year, there are 151 students enrolled in, thank you very much, Michael, 151 students enrolled in the paramedic programs. That compares to 74 students in 2024. So almost a doubling, actually more than, am I doing the good math there? Yeah, more than doubling the students enrolled in the paramedic program, which is another area where we had shortages. So lots and lots of work being done to make sure that we're training the professionals that we need, that we're giving them an attractive environment to practice in, that we're retaining people in our system, that they're being paid competitively. We've worked out collective agreements not only with the nurses, with the nursing home union as well, with numerous different locals with CUPE, and we're going to continue to do that. Oh, one thing I missed actually that's also related to this is the labor mobility piece. So we implemented a program of credential recognition so that anybody who has a Canadian credential in healthcare can come and practice immediately when they land in New Brunswick. They just have to let the registrar know that they're here and provide that copy of their other province certification, and then they can get going so that we don't have to wait weeks and weeks, in some cases months, to go through that process before they can start caring for New Brunswickers. So that's something that has helped as well. I might as well take a minute just to remind everybody where those 7 family health teams are based. On a créé les équipes de soins familiales à Campbellton. Celui-là était nouveau. Il y avait 2 médecins de famille qui ont pris leur retraite. On a embauché de nouveaux médecins de famille et on a ajouté des infirmières praticiennes pour cette clinique qui peut prendre de nouveaux patients. Il y a un à Moncton avec les infirmières praticiennes. À Miramichi, the Nordine Clinic. The Carlton North Clinic in Florenceville, where we've supported the addition of more nurses. There's also up in Florenceville, we're working with the pharmacy there to expand what they're able to do for patients. So looking to get that nailed down shortly, as well as continuing to work with the team in Woodstock on that opportunity there. The Tantramar Clinic, we opened and added capacity to. À la MEC, les cliniques aussi, puis à Fredericton, le nord de Fredericton. Alors, ça sont des équipes de soins familiales qui prennent des nouveaux patients et qui vous servent. Ils vont avoir plusieurs d'autres dans les mois qui s'en viennent. Puis, la dernière chose que je voulais dire ici, je sais que ça faisait beaucoup d'informations au sujet de santé. C'est que la dernière partie de la question était quand est-ce qu'on peut voir des améliorations? When can we see improvements? And look, that's a question that I am asking every day, right? We're out there doing this work, investing in training. We know there's a lag. You have to get somebody into the class, get them trained, have them learn, then they graduate, then you can employ them in the system. We set up these collaborative care clinics and they start to take people off the wait list, and then that snowballs. And so we are hoping that if we continue to invest in forming the healthcare professionals that we need, to make it a really attractive place to practice here, to continue to accelerate the rollout of the family health teams and those collaborative care clinics around the province, that we will start to see that tipping point where the list stops growing and actually starts shrinking. And I'm hoping that that's going to come as soon as possible. We committed to getting that, to getting the coverage in the province up to 85% before the end of our mandate. And I'd like to see us beat that. So we're checking these statistics and our performance every quarter, and constantly tweaking what we're doing to make sure we're doing the right things that make this the most desirable place to be a healthcare professional, so that New Brunswickers can get served in clinics close to home and don't have to be waiting for a dozen hours at their local, if they have a local emergency room. So I'm hoping that you will start to see and feel those improvements sometime around mid next year to the fall. Some people are starting to see it if they're the lucky ones that have come off the list and have gotten a new doctor. And maybe they're seeing it in some of the relief and support we've been providing to nurses, or maybe they're seeing it because they just had a new grad help them out on the ambulance. But I'm hoping that we'll start to feel the benefit of the 12 months of hard work that Dr. Dornan, the team at the Department of Health, the team in the health authorities, our partners at Medivy, and everyone who's out there in the healthcare system right now who's working to speed up the changes, to change how we deliver care, so that the New Brunswickers can get better, quicker access where they need it to be for the as quickly as possible. So I wish I could tell you you're going to see improvements on December 18th. We have a schedule to make those improvements, a timing on the targets that we want to hit ourselves for people off the list, and for wait times reduced, and we're going to hold ourselves accountable to that and ask you to do the same. But I really hope you'll be feeling some of the benefits of this work and these investments into next year. Okay. Maybe that will help. Okay, next question. We had 42 votes for this one. What are you doing for the single New Brunswickers who are working and struggling with the economic instability to own a home, pay rent, and get ahead of bills? Every benefit seems to be for families. So I can appreciate that, actually, as you're hearing about different things that are being done and thinking, well, that doesn't apply to me, and then that doesn't apply to me, and what am I eligible for? So a couple of the things that we did were broad-based, I'll say, and I think that single people as well as families could benefit from them. I mentioned the 10% that we took off electricity bills. That applies regardless of the status of the home. Or the apartment. We did implement a rent cap at 3% because we were seeing rents increase dramatically here in New Brunswick to the tune of 10, 11%. We had the highest increases in the country. And so we've capped those at 3%, and that benefits all renters. We did freeze the property tax assessments as we overhaul the property tax system. So that's something that it's for homeowners, I guess, whether they're single or family alike. And now, just today, that taking the cost of carbon adjuster off the price of gas, that reduction of 8.24 cents on the price of gas, that benefits anybody who goes and fills up at a gas station here effective December 1st. So we do try to balance what we're doing that is broad-based and that would benefit everyone versus some of the more targeted programs like the school breakfast program that's targeted at kids and making sure that they can get a good start to their school day, or something like the RSV vaccine that's targeted at seniors. So that's a few of the things that would apply to single New Brunswickers. The next question. I think I've got two more questions here, and then en français. So this one got 40 votes. With the cost of living being high and some struggling to get jobs in their fields, will the government do something about student loans, offering relief or clearing the provincial portion? So we've been hearing that it is and has been expensive to be a student right now, and those costs, whether it's apartments, whether it's gas or groceries, as we've already talked about, or otherwise, are rising. One thing that I'll credit the previous government, they removed the interest on student loans, and that's a policy that we're going to keep in place so that student loans don't generate interest. Everything you put onto your student loan goes right towards paying down the balance. There is something in place called the Repayment Assistance Plan, the RAP, the RAP, and the Repayment Assistance Plan for Borrowers with Disabilities, the RAP-D. Those can, if you apply for those, they could reduce or even pause your monthly student loan payments if you need that assistance. And we would encourage folks to reach out to the student loan, your national student loan account. That's where some of these assistance programs are, and you can apply through your account if you have one with the National Student Loan Program to take advantage of those. But here in New Brunswick, we won't charge interest. We won't make money off of your loan here. And I appreciate the suggestions of some form of relief or clearing to be considered for students that are struggling to get out from their student debt. Next question, number 39. Oh, I'm just going to check. Okay, it's 7:50, so 10 minutes left. Nova Scotia, PEI, and Ontario have no provincial tax on children's clothing, footwear, diapers, car seats. Why can't New Brunswick do the same by simply reducing arts, grants, or similar luxuries in provincial spending? So this is an interesting one, and this got 39 votes. I don't know if I said that. I'm going to give you the simple answer, and then I'm going to give you a bit of a wonky answer for those of you who are interested in stuff like that. This question gets at something we've been talking about quite a bit tonight, and that is the cost of living and how expensive everything is, and the fact that a number of kids' expenses are tax-free. And so if other provinces and even here in New Brunswick have removed tax on some of those things, why not more to help with the cost of living? And we've been looking at a lot of ways to make life more affordable. So this is something that we have looked at to see how it could work, to see what items we could target. And one of the things we learned about this is, if some folks may remember, that we originally committed that we would take the provincial tax off of your power bill, the provincial portion of the HST. But that is governed by an agreement that we have with the federal government on tax sharing. So when we put in that harmonized agreement, we agreed that we would share tax, and we are allowed, I think it's a 5%. So we are allowed to exempt 5% of provincial purchases from provincial tax. There's some things that are already in that category, so that's used up some of our credits. If we had used our provincial sales tax and exempted it, that would have eaten up, because it was about $90 million worth of savings for New Brunswickers, that would have eaten up a lot of our 5% room and left us with a very small amount left to play with. And so instead we thought we can put this on as a rebate on your bill, save us that room, and actually consider what other items we could potentially exempt from provincial tax to respond. So there's a little bit of an analysis happening right now to weigh up what targets who. I mean, if we look at the previous question, it was also asking about what benefits singles, what benefits families, what benefits kids. The description here names footwear, diapers, car seats, some expenses that are particularly child-related. So that's something that we're digging into to understand the costs, the benefits, and the best way to do that, and comparing the mix across provinces as well. So no final decisions yet, something that's definitely worth reviewing, because we think we could have some targeted tax relief there for New Brunswickers. OK, je pense que je peux faire 2 autres questions, peut-être. Et la prochaine, c'est une question français qui avait reçu 14 votes sur le système français. Pourquoi vous n'avez pas de règlement pour les personnes qui sont les propriétaires de blocs appartements pour prévenir les hausses de logement pour les résidents quand ça leur dit de la faire? Alors, nous avons fixé un plafond de loyer à 3% compté le 1er février 2025. Alors, c'est en place maintenant, il restera en vigueur en 2026 aussi. Et ça devrait, c'est quelque chose que le propriétaire de bloc appartement, il doit suivre cette plafond. S'il ne le suit pas, c'est quelque chose qu'on vous demande de nous laisser savoir parce que c'est contre les règlements et il ne peut pas le faire. Alors, si c'est la réalité pour vous autres, laissez-nous savoir. On fait une révision également de la loi sur la location des locaux d'habitation afin d'offrir une plus grande stabilité aux locataires. Alors, on cherche d'autres façons d'améliorer ce projet de loi, une modernisation, puis de le rendre quelque chose de plus fort, plus clair pour le propriétaire et les locataires de même, parce que ça fait longtemps depuis, ça a besoin de changer. Alors, si vous avez des personnes qui donnent des hausses de logement qui sont plus hauts que 3%, s'il vous plaît, laissez-nous savoir. Je ne sais pas, you'd reach out to the TLRO, the Tenancy Landlord Residential Office. I don't have that acronym right. But there should be one in your community or a line that you can call, actually, and I apologize that I don't have it memorized off by heart. Mais il ne peut pas donner une hausse de vos logements de plus que 3%. Alors, on peut vous aider si c'est le cas. Okay, next one. I think this is the last one. See, there's lots more that I did not get to as usual. Okay, 40 votes for no, I've already answered that one. Okay, what are you doing to help the working class that are the working poor? There are no resources for people who are in the average income bracket and we're falling behind because of it. What will you do? So this question had 29 votes. It's actually similar to the previous one that was asking about singles. And I've heard this actually repeatedly from folks who feel like they don't fall into that lower bracket where there are more supports available because there's an income threshold and they're just above it, or that they're the working poor, so they have an income, and sometimes just the fact of having an income renders them ineligible for a number of the programs that are targeted to help folks on social assistance or to help people who are struggling and vulnerable. So feeling like you're just getting by and that's where all the supports end. It's something that I've heard expressed because more and more people are feeling the strain of the cost of living, and it's starting to affect more of our population. So I don't want to sound like a broken record. I'm going to list off some of the things we're doing that do affect everyone regardless of income level. So the 10% off your property tax bill, the freeze of your property tax assessments, the 10% off your electricity bill, the rent cap at 3%, the overhaul of the property tax system will benefit all property owners, the 8.24 cents off of the price of gas at the pumps. Those are things that are all targeted to help New Brunswickers, working poor, and others. Certainly the school breakfast program that helps families that are really struggling to put food on the table and to send their kids off with breakfasts or a lunch bag every day and know that they can send their kids to school and they'll be able to have a healthy breakfast at school to start their day. So that's something that we believe helps those folks that are having a hard time at home. And there's more that we can do. So there's commitments in our platform on this subject that are teed up for us to work on and roll out in the years ahead, because not a day goes by that we're not thinking about how can we make life more affordable. That's why we took the cost of carbon off the price of gas today. That's why we're looking at more measures, more property tax reforms, other ways that we can help you tomorrow. And we're going to keep doing that. Alors, je pense que ça nous rend, it's like 3 minutes to go. I hope I didn't skip over any questions in the order. I'll say again, we'd love your feedback. The way that we had done it this time, putting out the opportunity to submit questions for 2 weeks, gathering those 300 questions, then giving it a week for you to vote on those questions, and then tackling the ones that got the most votes. Let me know whether you like this better or differently than the previous version, or if you have suggestions on how we can do this differently. Moi, j'apprécie énormément que vous avez soumis 300 questions. Ça m'aide beaucoup. Honnêtement, notre équipe au complet, voir vos questions, c'est typiquement différent des questions des médias. Et nous autres, on veut être disponible aux médias, mais on veut aussi être disponible pour vous autres et on veut savoir c'est quoi vos besoins d'information, c'est quoi vos priorités que tu veux qu'on travaille là-dessus. Pour nous autres, notre focus, c'était le système de santé et améliorer votre accès et rendre la vie plus abordable. Ça, c'est notre 2 grosses priorités qui ont pris beaucoup de notre travail durant notre première année comme votre gouvernement. Mais vos questions, ce que vous nous demandez, ce que vous partagez avec nous, ça nous aide à ajuster nos priorités, à changer nos pensées pour mettre en place les bonnes politiques, les bons investissements, les bons projets de loi qui répondent à vous autres. So thank you to everyone who submitted one of these questions, to everybody who voted, the 1,800 and I don't remember what the number was now, 1,943 votes that we received. It is extremely helpful for us to know what's on your mind and what questions you're asking, because they're sometimes different from the questions the media is asking. So we make ourselves available to media, we make ourselves available to you to hear your questions and to learn from what you want to know to make sure we can get you the information you're looking for and that we're doing the work that you want us to be doing on the things that matter most to you. For the first year of our mandate, it has been healthcare and affordability, making affordable housing a priority and making sure that you're getting better access to healthcare. And going forward, we will continue to focus on those things, but we'll adjust as we hear your questions, as we get your feedback. We want to make sure that we are working on the things that are most important to you. So thanks for tuning in tonight. Merci beaucoup pour vos questions, pour vos suggestions, pour votre engagement, pour le fait que vous êtes tellement intéressés au Nouveau-Brunswick que vous êtes ici avec nous pour 1 heure ce soir pour écouter ces questions. Thank you for caring about New Brunswick so much that you just spent an hour watching this live Q&A. I really appreciate it. I love this province too. And I hope you have a good night and a happy Halloween. Bonsoir.